Yes, ladies and gentlemen, please let me give you some information on dementia, on epidemiology, on economy. Worldwide, the prevalence rate of dementia is estimated to be 2% among persons aged 65 to 69 years and 30% those aged 85 years and older. And it is estimated that there are 35 million people living with dementia worldwide today, increasing to 65 million by 2030 and 115 million by 2050. Nearly two-thirds live in low and middle income countries where the sharpest increases in number are set to occur. Dementia mainly affects older people. Also, there is a growing awareness of cases that start before the age of 65. After age 65, the likelihood of developing dementia roughly doubles every 5 years. Given the increasing proportion of older adults, dementia is bound to become a growing health care expenditure in future decades. The total estimated worldwide costs of dementia are 600 billion US dollars today. About 70% of the costs occur in Western Europe and in North America. Costs were attributed to informal care, that is, unpaid care, provided by family and others. Direct costs of social care, that is, provided by community care professionals and in residential home settings. And direct costs of medical care. Costs of informal care and the direct costs of social care generally contribute similar proportions of total costs. That shows us that the family is highly involved in caring for demented people. Dementia is a syndrome that can be caused by a number of progressive disorders that affect memory, thinking, behavior, and the ability to perform everyday activities. Alzheimer's disease is the most common type of dementia, but it is not the only one. Other types include vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Very important is that brain pathologies lead to dementia all start well, 15 to 20 to 25 years in advance of the onset of clinical signs and symptoms. Very important, 15 to 20 to 25 years before onset of symptoms, dementia is developing. Early indicators include subjective memory impairment, mild cognitive impairment, and the biomarkers of underlying degeneration of brain cells are also being intensively researched. Dementia reduces the ability to learn, to reason, to retain or recall past experiences, and there is also loss of patterns of thoughts, feelings, and activities. Additional mental and behavioral problems often affect people who have dementia and may influence quality of life, caregivers, and the need for institutionalization. As dementia worsens, individuals may neglect themselves and may become disinhibited and may become incontinent. Especially in the later stages of the condition, affected persons may be disoriented in time, in place, and in person. Ladies and gentlemen, there are no medications that are clinically proven to be preventive or curative of dementia. Although some medications are approved for use in the treatment of dementia, these treat the behavioral and cognitive symptoms of dementia, but have no effect on the underlying psychophysiology. Non-pharmacological interventions, that means therapies which do not involve drugs, but are including psychological and psychosocial interventions. These non-pharmacological interventions have the potential to improve cognitive function, delay institutionalization, reduce carer strain and psychological illness, and improve the quality of life. Ladies and gentlemen, is there a preventive potential of Alzheimer dementia? In that sense, we can say yes, that it is possible that we will delay the incidence of symptoms. Please keep in mind that the Alzheimer dementia occurs 15 to 20 years before symptoms are occurring. And our aim is to do our level best in order to make possible that we have a delay in the incidence of symptoms. That is very important. And the next aspect is that we do our level best in order to control the course of the symptoms. For example, to alleviate or to mitigate the symptoms, especially at the early stages of the dementia. That is very important. That is a very important preventive potential. Use it or lose it might be applied to the brain when it comes to dementia. Intellectual cognitive activities help keep the mind in shape. Activities such as reading, playing cards and board games, and playing a musical instrument are also very important. And I want to focus also on the importance of physical activity. Why activity contributes to prevent dementia could be explained by a brain reserve built up by the brain. Additional connections between neurons are created, connections more resistant to the deterioration seen in dementia. Since vascular dementia is the second most common form of dementia after Alzheimer's disease, decreasing risk factors for cerebrovascular disease also decreases the risk factors of dementia. Thus, physical exercise, having good blood cholesterol, healthy body weight, and blood pressure lowers the risk of developing dementia. An active lifestyle can almost halve the risk compared to a sedentary one. In order to lead to the discussion between our ladies, please let me say, it is possible to maintain the emotional resources in the late stages of dementia. It is highly necessary that demented people experience a lot of sympathy, a lot of solidarity, a lot of supportive environment. In this case, it is possible not only to maintain the emotional resources, but in some sense to be creative in having quality of life, to be creative in having joy, respectively happiness. Thank you so much, and now we'll continue with a very good and personally oriented discussion.
Thank you very much, Professor Kruse, for this enlightening factual introduction. And now I give the moderation, I guess, to you. It's a little improvised, you know. We have not planned or exercised. So, well, yeah, please.
Yes, I think it is necessary that we will focus also on the position of the carers. The carers, for example, within the family. And my question is going to Mrs. von der Leyen. What about your experiences regarding a supportive environment? What are your experiences regarding the emotional resources of your father, in how far you can support him by showing solidarity, by showing sympathy, by showing help?
Yes, we decided to do an experiment here because it's very personal for the two of us. Our fathers have dementia, an Alzheimer's disease, and I want to talk on this DLDwomen about the daughter's position towards her father or her mother. It's a very specific position. And I learned a lot during my work with you as a politician. I learned a lot for my personal life. And the thing I want to emphasize at the beginning is don't feel ashamed if you have a bad conscience towards your father or your mother. Don't feel ashamed if he or she is acting weird and in a specific manner in the open space with other people, which is puts you into a weird position. Don't feel ashamed if you are fed up with him or her. I learned a lot about accepting my own emotions. First of all, it is okay to be angry. It is okay to be fed up when he or she is coming 10, 20, 30, 40 times a day with the same questions. But the second lesson I learned from you is, if you invest time, and you want to invest time, because you are the daughter, try to spend a positive time with your father, in my case, with my father. So don't waste your time in having negative emotions, but try to find the positive moments, because it gives you a good feedback for your own life and for his life too. And what I learned is, if I try to put apart my emotions, which are okay, like I'm allowed to have them, and if I try to focus on his personal life, kind of dig for memories, find the positive moments, all of a sudden he's getting quieter, he's getting happy. When he's happy, he starts to sing, for example. So I realize when we are doing fine, and the emotions are okay between the two of us, he starts to sing. And I realize then I get calmer, my bad conscience gets less, my being fed up is less, and his nights are better, his days are better, and it's easier for us.
That means that the emotional state and the cognitive state of your father, in some sense, is dependent on your own emotional state?
Yes, you're right.
Okay.
He's so smart. Yeah. He puts in word what I try to put in a long.
No, but it's exactly what I've experienced, and actually in preparation of this little panel, I read things from you, and I read, and it led me to a much bigger curiosity towards my father. And I realized how much, very often when I went to see him, it was with this feeling, oh my God, I'm going to see what is not working today, maybe even harder to stand. Yes, it's harder to stand. Oh, he don't remember that. Okay, he doesn't remember that. And I'm exaggerating a little bit. And then the next time, and after reading this, I completely switched, and I was not coming first with my, looking at him, judging it, and, like a doctor seeing, okay, this is not working today, this is worse than yesterday, oh, this is a little better. But I went there with a much bigger kind of curiosity. What's coming from him? Oh, interesting. Okay, I'm not judging his eyes are different, they're a little dead. No, through these changed eyes, there's still so much coming, so much interest in me, so much longing for attention. And it completely was amazing. It really, like turning the switch, as you said, it's much calmer, and the more attention I was curiosity came from me, the more there was coming, the more emotion, the more attention. And so to me, it seems really crucial, this different approach.
I have a question to both to you. Normally we are perceiving patients suffering from dementia only on the perspective of losses. Right. Do you think that there are some resources, for example, emotional resources? Do you think that you can recognize some emotional resources when being very concentrated on your father? Do you want to start?
Yes, what I've learned is to change my view of the picture my father represents. My father was a politician, and he was kind of a mighty politician, so he was a very big personality,
I can remember.
Yes, an authority. People were scared of him from now and then. In the dementia, all of a sudden, I discover what his basic nature is or was.
Okay.
And his basic nature is friendly. He's a
friendly person.
He's a friendly old man.
Very good.
He has a very small world. And the second part, which is so interesting to discover in the fathers, what are the driving factors of their lives? Because when your life gets smaller, smaller, and smaller, and smaller, all of a sudden it gets reduced to one or two factors that are persistent. In my father's life, it's his love to his wife. He keeps talking of my mother, who's dead. And the second thing is Europe. He still has in mind being a post-war generation, never ever war again. He keeps telling me about how important Europe is. The sentences are weird he's talking about, and it has nothing to do with the actual stage we're in. But I start to realize these two things, his love for his wife and his love for Europe, were the driving factors of his life. His whole life as politician is gone, faded. I can't ask him anything anymore. So it's interesting as a daughter to discover new characteristics in your father when you take your time. And may I
when you take your time,
may I add something?
I think that is very important.
Don't put too much burden on your shoulders as a daughter. Don't do it. Share the burden. You need time off of your father or your mother. You need time off. Otherwise, you're not going to make it.
What is your perspective on the emotional resources of your father?
Well, I think my father has changed a lot, and there we have a difference. I didn't have such a good relationship to my father before. We had a very complicated relationship, actually, and so it's pretty weird when your father, starts to go into dementia. And I discovered in this period, in the last years, a much more gentler man. He's much softer. My father never ever said, "Oh, thank you for coming," or "Thank you for sharing this with me." And nowadays, my father would again and again say, "Thank you, it's so nice that you're here, and thank you that you're going to swim with me." And it's like, oh my God, I mean, he never said this before. And so there's, actually, as you said, and what he's always been, I think he remained a pretty happy person. He's not an unhappy man. He's never been, I think, and he still is. Every now and then he realizes how much, that he lost so much in his brain, but I think he still enjoys life a lot. And I would like to ask you, because you mentioned it, and I mentioned it before, sustainability. What can we do, what can I do with my father, or what can we do now that we still feel that we're not having dementia? Who knows, maybe in 10 years, and it already started 10 years ago. What can we practically do to really be more sustainable and support those who already are touched by dementia?
I think to answer this question, I can link my answer with the statement of Ms. von der Leyen. I think it is necessary that we will develop competencies not only in the cognitive area of personality, but for example, it is very important that we have what we circumscribe as dominant concerns in the life. For example, Europe, or how to behave against other people. That could be a dominant concern. It is necessary that we will develop such dominant concerns, for example, music, literature, being together with other people, because the resources are very important, the resources whom we will go into the process of a dementia. And what we can observe is people who had been able to develop quite a lot of competencies, not only in the cognitive area, but also in the emotional area, or in the motoric and in the physical area, or in everyday life. They have some resources until the late stages of dementia. And that is a term, or we have described it or circumscribed it with the term of sustainability. It's not only that we ask, is it possible to compensate for, but it is possible, or are we able to maintain some resources in the process of dementia? And for example, your father had been a politician. and he had been highly engaged in politics. And it is very interesting that this dominant concern is lasting until the late stages of dementia. And I think that is a very nice example. Yeah? And what you have circumscribed, or what you have described, is, of course, sometimes we have a tremendous change in personality, in a bad direction or in a good direction. And I think your father has shown that it is also possible to have a change in a positive direction, becoming much more friendly. Yes. My question is, what do you think about dementia, the course of dementia? In how far we can contribute personally, and in how far we can contribute as a society to quality of life of people suffering from dementia? What do you think? And
I think, first of all, the public discourse is extremely important.
Yes.
And I feel the public discourse about dementia is still very negative.
Yeah.
Because it tells you what is going wrong, what is awful. It kind of sends out the message, if I get dementia, I'm going to commit suicide, because I don't want to have that.
That is a very important point.
My experience as a relative was, or is, you are not being asked whether you like it or not. You have to live with it for years and years. And therefore, it is horrible to have a society that talks very negative about it, but because it kind of pulls your ground away from your feet you're standing on. So you need just the other way around. You need a discourse that is positive or objective about dementia and talks about the process over years. I was so grateful always when people explained me that what I experience in the moment, they had experienced too, and I shouldn't feel bad about it. Like taking away the keys of the car from my father. We had huge fights about it for months. And only when other people told me, this is normal, don't worry, you're right, I felt less bad about it.
Very good. Huh?
Or for example, my frustration and my anger, when I had a discussion with him at the beginning, and I had the impression I run against the wall because there is no emotion coming back anymore. Till you taught me that a demented person is not able to swing back the vibration you send out as a relative. And after I've understood that he is not able to share my emotion with me again, I understand why this wall is so rigid when he kind of looks at me and I feel joy or anger or frustration, and almost nothing seems to come back. After having understood that, my expectation towards him is more objective, and then all of a sudden, we find the basis where we can communicate. But I needed that process. And my wish is, let's communicate more positive, and let's inform much more about what is normal, because it takes not only months, not only years, it takes decades. You have to live with that disease.
Very good. What about your opinion regarding quality of life? In how far relatives, in how far the community can contribute to quality of life in patients suffering from dementia?
I certainly think they can contribute a lot. But what we're experiencing, here's my stepmother, Susanne, the third wife of my father. He had many wives. My first wife, my mother is here too.
Speaking of dementia.
Speaking of dementia, there it is. Well, I'm in my 15th year probably, I don't know. No, but there's one thing I wanted to mention before forgetting it, is that I think that we really live in a society, and you mentioned it so beautifully, where the worth of a person depends so much on his cognitive ability. And I so much come from this background and from the system, as Mrs. Bonnet just said, in which being, fully aware, full in control, seeming control of everything, defines the worth of a personality. And so this is the problem I had at the beginning, is that he was less worth. Does that make sense? And this is maybe the big paradigm shift we need to face, is that we don't connect the worth of a person one-to-one on his connective ability. And actually, if we really let this go and look at the person the way it is now, and not always look at all the losses, because they are tremendous and they're getting bigger and bigger, and still value what is there, then there's a a lot of things to discover, really a lot of things to discover,
I think that's a very interesting perspective. So last question, because we have 2 minutes and 30 seconds.
We have 4 minutes and 34.
Because we want to close it with John Sebastian Bach, that is the reason. My question is, what about the dignity of demented people? Dignity, in some sense, is a very abstract term. And our position is that it's necessary that dignity has a possibility always to realize, to communicate. And my question is, against this background of understanding of dignity, what do you think, what is the dignity of demented persons, and what we should do in order to show our respect to the dignity?
Whoa, it's a big question.
The last question.
Yes, my experience is the longer I accompany my father, it's like 8, 9 years by now, the more I realize that how inherent his personal dignity is. It is there, and you cannot take it away, thanks God. It's human. Therefore, thanks God for what you said, that you realize it's not only the losses, but you win something.
I think that's
There's a specific, he's not only a huge father figure because he has qualities or can represent something in the open world, but inside himself there is an inherent dignity, like in every human being. And it's more or less our duty to discover this dignity even in physically awful stages.
But as you said, Ursula, very often we walk past this, let's say, if there was a limit of red line of dignity. For instance, when we take the keys of our fathers away, and it's such a tremendously important thing to be allowed to go and to move and to drive wherever, whenever I want. So we take things away. And now very recently, my father went basically every morning down to the lake and jumped head first into the lake and had his morning swim, or whenever in the day. And so he hasn't been doing this for quite a while, and I thought we should try to go back to this. But I was, of course, scared because I realized the swimming was getting so bad. And so I bought him some, how you say, Flügelchen?
Yeah.
This,
swimming aids.
Swimming aids, the big ones, you know, for adults, and I put them on, and he was, of course, really upset, said, I don't want this, it's ridiculous, and I said, come on, let's try, and then we moved on the Sprungbrett, and I tried to help him, and he wasn't really able to jump, but the only way to go into the water was the head jump, as always. So I said, okay, and at the end I was like pushing him, so if he finally, you know, would jump, and then he came up, you know, and I of course jumped right after him, you know. He came up between his head, between his huge swim aids, and it was such an incredible moment, my father's face between laughing and crying, because he loved the moment to be in the water, but he hated as well, because he was so aware that this is not a moment full of dignity, and I'm always like, you know, it's difficult to decide, and whenever we go down and say, okay, you want to go swim? Yes, but without those ridiculous things, and then, you know, okay, Daddy, let's try, but at the end, you know, I'll put him on, because there's no other way.
Thank you so much for this very intimate, very honest